Okay, welcome back to the Oral Health Podcast with Karen and myself. So, because it is Learning Disability Awareness Week, it's a topic we've kind of touched on in the past, like amongst other things, but actually it'd be quite good to sit and talk specifically about additional challenges that a learning disability can play in terms of managing your oral health. Um, and also what professionals can do to better support people who have learning disabilities. Karen, obviously, being an oral health educator, I guess you probably are kind of used to having to say the same things, but in slightly different ways, depending on who it is that you're talking to.
Yes, I mean you do. You have to adapt the way that you communicate. It can be difficult to communicate the importance of good oral health to patients with some learning difficulties. So it's really vital that we get across that they do need to clean their teeth, how we recommend to do it, and why we are asking them to do this. So giving them the tools to be able to understand the reasoning behind why we're asking them to clean their teeth. That can be one of the biggest challenges because a lot of people don't understand the knock-on effect it can have if you have poor oral hygiene and the consequences of not looking after your mouth as well as you could do. Often people with learning disabilities do like a routine, which is great. We like routine. We like our 2 minutes last thing at night, at least one of the time of during the day using a fluoride toothpaste. We repeat that message over and over and over again. Um, which is great for somebody who perhaps needs that message more than once. And it's something that we can just reiterate when we talk about our key messages. Our key messages are simple, and we have three key messages. The one that I've just said, brushing last thing at night for 2 minutes, at least one of the time during the day using a fluoride toothpaste. Cut down on the amount of sugary foods and drinks you have. Visit your dentist regularly as often as they recommend. So those are the three key messages. It can be difficult. A lot of people, they don't associate the eating of sugary foods and drinks as being a catalyst for dental problems. So it's really important we get over the dietary point of view. And often that can be in conjunction with the parent or the carer. It's very important to have them on board equally with the oral hygiene routine, but also looking at diet and the frequency of the sugary things. And again, with the visiting the dentist, that can, bring its own challenges in itself, because again, we're talking about repetition and everything being broken down and explained to. It's often quite good if your dentist has experience of treating people with learning difficulties. You can almost get a passport. So you have your own dental health passport. And inside that will be about you as the person, what you like, what you don't like, what you're worried about going to the dentist. So that's all things that can be done before an appointment to get somebody ready. It's really important to make people feel comfortable. Anybody should feel comfortable going to their dental appointment. I mean, obviously we all have a bit of reticence and a little bit of fear of the unknown. But I think if we can break it down and make it a more we can take away the unknowns, if you like. So, you'll go in and you'll speak to the receptionist and give the receptionist your name, and just going through the various stages of going for a dental visit. It's really important.
Yeah, and I think as well it's important to remember learning disabilities, the spectrum of that is really, really broad. I mean, that can vary from someone that has very severe challenges to someone with a touch of dyslexia or something else that means it's things take a little bit longer to settle in, like a processing problem or anything on that spectrum. But so it's important to remember as well things like easy read leaflets. So as well, someone, for example, for myself, I don't have a learning disability, but I definitely find videos and listening to things a much better way of absorbing information than reading it. And for others, it'll be the exact opposite. Like everyone learns things in completely different ways, but
Totally.
you just
Yeah,
got to keep that in mind, haven't you?
absolutely. Yeah, and if somebody is more of a visual learner, um, it obviously having having the facility to be able to talk through the visiting to the dentist. I mean, we've probably got videos on our website that you could pull up if you're wanting to show somebody, or even yourself, because it's beneficial to all of us. We're not just sort of singling out. I know it's Learning Disabilities Week, so we are focusing on that group of patients. But as you say, there is a massive, massive, wide range of what would be put in that category, um, which is not hugely helpful, really,
No,
because
it's
as you
not.
say,
But
no, it's
nothing's ever
not.
straightforward, is there?
No, never, never. I mean, my daughter has a processing issue, but she would never, she wouldn't even think of putting it on a form. If somebody says, "Do you have any difficulties?" She wouldn't put it on there because to her, it just means she has to read things twice before it actually sinks in. Just takes her a little bit longer. But she doesn't see it as a disability. She actually sees it as more of an ability because she actually reads something twice. So, that's sort of very sort of on the very minor spectrum right the way through. Somebody doesn't isn't able to live independently,
Hmm.
and they will then be coming along with a carer. I think it's really important though to remember that you are dealing with the person and not the carer, so making sure that you are interacting with the patient rather than speaking as if they're not there, which is the worst thing that you can do. You build a rapport as well. So if you see somebody several times, it's much easier for them to say, "I know you, I recognize you," that everything's going to be okay because they've got the support from their family or their carer. And I think that's really important, and it's working slowly with somebody. You can't go in there sort of all guns blazing. You have to kind of broach the subject. This is what we're going to do. We're going to start off gradually. And I think when a patient realizes that it's okay, it's somewhere different, but it's not somewhere different horrible, it's somewhere different.
Yeah, it's an important distinction. And another important distinction I feel like I must highlight is that often autism and neurodiversity get tarred with the same brush as a learning disability when
Mhm.
they are not learning
No.
disabilities. They have overlap, I guess, in how a professional might approach someone to say like the routine and recognizing maybe early appointments aren't going to be the best. Let's schedule an afternoon one or vice versa. But
Mm.
they are very, very, very different, very different things.
They are very
And
different. They are very
yeah.
different. But often, as you say, there is an overlap on and the way that we treat patients. And um, again, with those spectrum disorders, the spectrum is massive again. So that's what's really, really important to find out about the individual, what their likes and dislikes are, how they like to be spoken to, how they process things, and getting them on board. Because for some people it will be, it's a carrot and stick kind of thing. Some people will like the softly softly and they'll get it, but for some people you've almost got to lay it on the line a little bit. If you don't do this, it will result in this. And I think it's nobody's perfect. We're not going to get it right every time, but I think if we keep in mind all of these things that we've talked about, then we will be able to at least get it as right as we can. But the more information that we have as the dental team, the better equipped we are to treat all of our patients, not just patients with learning disabilities, but especially during this week of highlighting um, learning disabilities. It's it's sort of touches on every part of life. but I think dentistry can be quite a personal thing. It's a personal thing that you are.
It makes you feel vulnerable because it is a
Indeed.
very vulnerable position you're in with your
Sure,
hand, someone's
sure.
hands in your mouth.
Yeah, 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 yeah. It is. And you know, you're lying in a prone position, and you're talking to somebody that you may have a mask on, and you know, they might not be able to communicate with you quite as well as you would like them to. And you know, there's all these things about not making it us look like we're, you know, from another world, you know, when we come in gloves, masks, goggles, all of
Does feel
that.
quite apocalyptic if you're not
Yeah, it can do.
expecting it.
You know, somebody's got loops on as well. It's, you know, we're not really looking as you know, we might do if you passed us in the street. But I think it's very important that we address that, and you know, perhaps come away from the chair, sit down in an area to have a chat before, put the person at ease, let them know exactly what's happening. As I say, pictures are great. We can use Makaton or any other language that somebody might be able to use. There are some great sites that you can actually get dental symbols, and you could even learn them, which, you know, if you say to them, or the person that's with them, do they use a particular sign language, and you know a little bit of it, they're not difficult to learn. Even I've done it, you know. That's saying something.
Yeah,
So,
Makaton and sign language, very different. Just popping in there to say
oh,
that.
absolutely. Yes, totally. And I wouldn't say, I mean, obviously, sign language takes a long, 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 long time to do, but a few signs in Makaton or similar are really not very difficult to learn and use. And I think, again, if that's something familiar, again, it's going to put somebody at ease.
100%. And an important thing as well, just to touch on, because it is a very broad topic that we're discussing today, and we're trying to kind of touch on each area. But I saw a really brilliant video from Down Syndrome Awareness Organization, and it's
Right.
all about not assuming things about people. So, like,
Yeah.
if you assume that I can't have that alcoholic drink, and you don't serve it to me, and then I don't have it, and it was about trying to help people break out of that stereotype and that box that you kind of build for
Mm,
people. And
mm,
there's a certain part of that I think that is applicable here because if you assume, oh, well, because they've got learning disabilities, they're not going to understand. So I won't explain it to them. I'll explain it to their carer. You're not giving them a chance to
no.
actually take in any of the information. And really, you're doing them a disservice.
I agree. I agree
Yeah,
totally. I think that's really important. You know, don't underestimate people because you never know. And just, yeah, start with the patient. They may say to you, I don't understand, speak to, you know, speak to my mom or whatever. They've then given you permission to actually then give the information to somebody else for them to then keep reiterating the information. So that, yeah, I think it's really important to treat the patient. You know, it's like somebody with you know, in a wheelchair. We talk to the person pushing the wheelchair. We're all guilty of it at some point or another, and I think we just have to be mindful a little bit.
yeah, absolutely. I mean, there's so many brilliant bits of advice that you can take away to help support people with learning disabilities with their oral health, just to name a few, like we've said, have a chat, see if there's a better time of day to book an appointment. If they know that they struggle with their routines in the morning, then maybe don't jump to book a morning appointment, or maybe even a double appointment. If you can't predict how someone's going to feel on the day, then that's always a good thing to do. Obviously, I'm saying this as someone that does not book dental appointments for people, and just as someone that's giving generic advice, it's probably in reality a little bit more difficult to book someone a double appointment or book a certain time of day, I'm sure. But
I
yeah,
mean,
plain
a lot of
English and
patients with severe learning disabilities may be seeing the community dentist, which obviously they have more experience in treating patients with specific needs, so they will have much more time. So if your dentist is not feeling equipped or confident in being able to treat the patient, they can refer them to the community dental service. So there are other places to go. So if you don't feel comfortable at your dentist, you don't feel that you understand it, or it's giving you extreme anxiety, then I would, perhaps ask for that referral. I think it's worth perhaps going somewhere else. But as I say, there's no reason that you can't build a rapport up with the dental team, and, start with start talking to the dental nurse or the oral health educator, or going to see the hygienist, or, just start gradually. And I think everything comes with familiarity, doesn't it? You feel much more comfortable the more times you go somewhere, because you'll say, oh, it's that same lady on reception. Oh, the nurse is the same person. And I've seen the same dentist. I think that's a really good thing. And again, I say that works for everybody. A lot of this advice is something that we would expect, um, you know, for everybody. And I think that's why we're saying, everybody has a right to be treated with respect, and, to the best of the clinician's ability. So I think it's important to remember that's for everybody, not just for people with learning disabilities,
Yeah.
but they just might need it tweaking a bit, just
Yeah.
changing a little bit.
Yeah.
So
Absolutely. And like we've said, so many times now, not just now, but across dozens and dozens of episodes that we've done, is that it's not one size fits all.
no,
Healthcare,
absolutely.
dentistry, any of it.
Absolutely. And I think this highlights it,
Yeah.
absolutely highlights that we can't actually say, right, this is what you do, and you do this for every patient, and everything will be absolutely wonderful.
Wouldn't that be great though?
Because, oh,
We'd be out of
actually,
jobs, but
I was just thinking, when I rule the world, that's what I will do. But no, I mean, everybody is different. And as we know with medical or dental things, nobody's the same. Nobody thinks the same. So we have to be mindful that we're treating an individual, and that's what we are, individuals.
couldn't put that any better myself. I think that's a lovely note to end on. Throughout the week, because it is the awareness week all week, we'll share a few different tips and things online. So follow us on social media. Just search Oral Health Foundation on any of the main accounts, and you will find us. But that's it for now from Karen and I. We've got a few more exciting things coming up over the summer, which we can't wait to share. Not least a special 10-part series where we're going to be talking through our manifesto in the lead up to the general election, which we're both very, very passionate about politics, I'm sure, but we'll try and keep it lighthearted and just focus on the oral health issues, not the rest of them, because we will be here all day. And yeah, that's it from us for now. And thank you very, very much for listening this far.